Can I call you Rose?
Hi everyone, so I'll be the representative of our group, and we are happy to share that during the attachment we learned about the foundational skills and knowledge required in pharmacy practice and developed various practical experience under guided supervision. We hope you enjoy our videos.
Oral administration means taking medication by mouth. Example of solid preparation include tablet, capsule, and powder. Example of liquid preparation include syrup, emulsion, and suspension. But the advantages of oral administration is convenient, cheap, needle-free, fast absorption for sublingual and buccal routes. While disadvantages include compliance issue, first-pass metabolism, systemic side effect. For storage and handling requirement, it should be stored in cool, dry place away from direct sunlight, protect liquid from freezing, keep out range of children, and a special consulting point to a patient is take medication exactly as provided. Be aware of potential food-drugs interaction, do not crush or chew tablets unless advised. Report any adverse effect to healthcare provider. And during the attachment, we have learned the difference between variety of tablets and the solubility of tablets in water.
Moving on to inhalers, they are small handheld device that delivers medication directly to your lungs. Inhalers can either be dry powder, metered dose, or soft mist, and they are the most common types of medicine that helps open your airways or reduce inflammation in your lungs. Some of the pros of inhalers includes that they avoid hepatic first-pass metabolism, they have rapid absorption as well as fast onset of action because of the large surface area and high vascularization of the alveoli in the lungs. However, inhalers require proper administration technique, and local effects may include irritations, oral thrush, and hoarseness. So for storage and handling requirements of inhalers, first you need to always keep the cap on whenever you're not using it so that dust won't enter the mouthpiece, and you always have to keep your inhaler dry and store them at room temperature. Now, patients are advised to always follow specific instructions on the device they're using on how to actually clean and use the inhalers, and they need to replace the inhalers when it's past the expiry date. And it's best for them to keep track on how many doses they have taken because it can be quite difficult to determine when to replace your inhalers. And never use water to clean your DPI or SMI inhaler. From the attachment, we also learned that inhalers are color-coded. So blue inhalers would be for fast-acting, orange or yellow would be to be taken daily to reduce airway swelling. And the interesting info that we learned is that aerosol chamber can also be used for pets.
Next dosage form is enema, which is a liquid dosage form administered rectally through the anus. It is used to deliver medication for local effects such as to relieve constipation or treat inflammation in the colon or for systemic absorption. Now moving on to the advantages and disadvantages of enema. So one of the advantages of enema is it is useful when oral administration is not possible, such as in condition of vomiting or unconsciousness. Furthermore, the advantages are local effect at the site of disease such as colitis. Enema also has rapid onset, usually between 5 until 50 minutes for laxative enema. However, enema also has some disadvantages. That is, it may be uncomfortable for or embarrassing for some patients. Next, it can cause local irritation or rectal damage if misused. For other information in terms of storage and handling requirement, we must store enema at temperature between 33 until 35 degrees Celsius, keep out of reach of children, and do not refrigerate unless specifically instructed. For special consulting point, firstly, lie on your left side with knees bent, then insert the enema nozzle gently into your rectum and lubricate if needed. Slowly squeeze the enema bottle to deliver contents, and stay lying down for a few minutes or as directed. Last but not least, here are some information that we learned during attachment, such as rectal drug delivery is useful for pediatric and palliative care. On top of that, self-administration is common for OTC products such as Mercolex and Fleet, and lastly, retention enema should be retained as long as possible for full effect.
Moving on to the case study part. During my attachment, I was fascinated to observe how temperature-sensitive medications like insulin and vaccines are properly stored. These medications were kept in a large industrial-grade refrigerator and well organized. I often wonder and worry, what if there was an unexpected electricity shortage? Wouldn't there be huge losses and safety risks due to temperature changes? However, the pharmacy staff reassured me that a backup power system and continuous temperature monitoring are in place to ensure the medications remain within safe storage conditions. This experience shows the importance of cold chain management in maintaining drug efficacy and protecting patient health.
Can I call you Rose?
Our attachment at Pusat Sejahtera was a valuable experience that helped us connect what we have learned in class with real-life pharmacy practice. We were involved in tasks like handling, labeling, and preparing prescription under supervision, which helped us build essential skills. We also explored different dosage forms and learned more about how medications are prepared, stored, and managed in a real pharmacy setting. This experience gave us deeper appreciation for the important role pharmacists play behind the scene in ensuring safe and effective patient care.
Can I call you Rose? 'Cause you're